So now we're going to demonstrate clinical examination of the pupils. So oftentimes we see reports coming from various offices where it'll say PERL, pupils equal and reacted to light, or PERLA, PERLA, pupils equal and reacted to light and accommodation. Now unfortunately that doesn't really tell the whole story on a pupil exam. Typically if we see that the pupils are equal size, that tells us that the efferent system driving the pupils may be normal. But it really doesn't tell us much about the afferent system, meaning what is the function of the nerve in the eye. And that's really what we're worried about when we're thinking about eye disease. So typically in ophthalmology what we're looking for is two features in a pupil exam. Number one, we want to know if there's an RAPD, a relative afferent pupillary defect, that's the afferent system being intact or not. And we want to know if there's anisocoria, meaning a difference in the pupil size. And that tells us if the efferent system is intact. So that way we can document the efferent and afferent system. No RAPD, no anisocoria would tell you that it was a normal pupil exam. So I'm going to demonstrate how you test for an RAPD. We use the swinging flashlight test for this. So you want to dim the lights in the room. You want a bright light source that's directional so that it's not shallow, falling on both eyes. We're going to get you to focus on a distant target. That's going to take away accommodation out of the picture. Keep focusing on a distant target on the wall there. And we swing the light back and forth with even timing. And we're looking for constriction. Now sometimes you'll see a little bit of rebound, but eventually it will constrict. Now if when you swing the light across, a pupil dilates rather than constricts, that's a paradoxical reaction. That's something you don't expect. That's a relative afferent pupillary defect. It tells you that that nerve is not functioning properly. The next thing we want to do is measure for anisocoria. So, oftentimes on your near card you'll see these little half circles at the bottom and they have numbers above them. That tells you the millimeters for pupil width. So you can use this to gauge the pupil size and measure in both eyes. It takes sometimes a fairly significant difference in size to pick it up grossly, but measuring it can help you pick up very fine anisocoria. So we'll get you to focus off in the distance, and you hold the card just above the pupil, get some diffuse lighting so that you can see the pupil itself, and then you find the appropriate size for each eye. So that's 7 millimeters and 7 millimeters. So there's no RAPD and no anisocoria in Dr. Shoham's eyes.